Hello class, today we will be talking about chronic diseases and risks. And in this picture you see a Navajo man getting his blood pressure checked. The disparities are not only between developing countries and developed countries, but also within our own country. In the Navajo Nation we see some of the worst health outcomes, very high rates of diabetes, high blood pressure, obesity, and there's a 40% unemployment rate among the Navajos. The outline for today's lecture is common features and epidemiologic trends of chronic diseases, risk factors, policy responses, chronic disease prevention, looking at the ICCC framework, and characteristics of the chronic illness care systems. The common features of chronic diseases are they usually occur in middle age. There's long exposure to adverse social, environmental, and behavioral factors. Some of these risk factors act synergistically, and there's a long latency between the cumulative exposure to the risk and the disease outcomes. What's most important is there's a high degree of preventability. However, there's a low cure rate and there's considerable comorbidity. And comorbidity is when two diseases or disorders occur simultaneously, and comorbid conditions can increase the risk of adverse outcomes. There's also strong linkage to poverty and SES, and chronic diseases require decades of treatment and care coordination. And I want to show again this diagram from Chapter 3 in Merson, the main determinants of health. And again, focus on how the general socioeconomic, cultural, and environmental conditions seriously impact chronic diseases. And some of the chronic diseases which are affected by living and working conditions and social and community networks, not just your individual lifestyle, but these overarching determinants affect such diseases as cardiovascular disease, hypertension, arthritis, diabetes, and cancer. The lower the socioeconomic status, you also have higher mortality, and the greatest of these disparities occur in middle adulthood. What are the epidemiologic trends? It's not infectious diseases that are causing the highest percent of deaths in the world today, but chronic illness. 60% of deaths are attributable to chronic illness. 80% occur in the low and middle income countries. These diseases cause substantial loss of economic output. And we've talked about the traditional epidemiologic transition, and what I really want to focus on is that the third stage is where we now have the degenerative and man-made diseases. What are the determinants? The ecobiological, the socioeconomic, which we've already stressed, political, cultural. So with these types of determinants, there's a great need for not just medical interventions, but for public health interventions. And the stark reality is that in low and middle income countries, there is still infectious disease, and it coexists with chronic disease. So you have a dual burden of disease. What are the common chronic conditions? Cardiovascular diseases. They are the leading cause of death in the world today. However, the age of death is lower in low and middle income countries for cardiovascular disease. Diabetes. Diabetes is growing very rapidly, and it's associated with urbanization, lifestyle changes, and the increases in childhood and adult obesity. It is estimated that 1 out of 10 people will have diabetes by 2020. And cancer, the incidence of cancer is increasing dramatically, and that occurs with more tobacco use, chronic infections, lifestyle, diet, and environment. Here is the distribution of deaths by the leading cause groups for males and females in 2004. And as you can see, cardiovascular disease is at the top, followed by infectious and parasitic diseases, cancers, respiratory infections, and the list goes on. What I'd like to stress is the neuropsychiatric disorders are 10th on the list, and they're increasingly adding to the burden of disease. And with this mental disorders, you have a high comorbidity of mental disorders with chronic diseases. For example, the proportion of patients with depression who have other common chronic diseases, such as cardiovascular disease, ranges from 22 to 33%. And we've seen earlier in Merson how unipolar depression is going to be the leading cause of dailies in the world by 2030. The determinants of major chronic disease. Aging. So we have the improvements in living conditions, and children are surviving infancy and childhood. And we also have this compression of morbidity model, which I will talk about in a minute. There's also urbanization, and there's also social and economic inequalities. Now, what is this compression of morbidity? Well, this gives us hope. This proposes that morbidity due to aging can be postponed or mitigated by disease prevention programs. Fries is the scientist behind this hypothesis, and he says that the burden of lifetime illness may be compressed into a shorter period before the time of death if the age of onset of the first chronic infirmity can be postponed. So that gives hope for some of us aging baby boomers. Age-related morbidity can be reduced and postponed with healthier lifestyles. It's never too late to start exercising and eating right. Globalization and development. This again shows that with globalization and development, there's increased trade, investment, and communications. There's the potential for better health with increased life expectancy, which we have seen throughout the world. But at the same time, globalization and development can cause social, cultural, and social shifts, including increased risk factors for chronic illness. For example, GNP increases are related to increased consumption of tobacco, alcohol, high-fat foods. Now, with globalization, you can see some of the lifestyle changes in this third row. And some of these lifestyle changes are pressure on time. This increased pressure on time can lead to increased stress. And with the increased stress, we will see an association with increased chronic diseases. The risk factors. The risk factors for chronic disease, number one, well, they always have it at the top here, tobacco. High blood pressure, high blood glucose, indoor air pollution, physical inactivity, high cholesterol, and these risks are cumulative over time. The major risk factors which explain a significant proportion of most chronic diseases are tobacco, diet and the physical activity complex, and alcohol. Tobacco use is the number one cancer-causing agent in the world, and cancer is increasing in most developing countries where you see this increase in the tobacco companies going into these countries and marketing their tobacco, and an increase in women smoking in some of these countries where before they did not smoke. Now, what's good news is that in a few developed countries, tobacco-related cancer incidence has started to decline as men smoke less. The diet and physical activity complex is getting more and more attention. And the key causes of overweight and obesity are the increased consumption of energy-dense foods high in saturated fats and sugars and reduced physical activity. Globally, in 2006, there were more than 1 billion overweight adults, and at least 300 million of these were obese. And obesity and overweight pose a major risk for several chronic diseases, including type 2 diabetes, cardiovascular disease, hypertension, stroke, and certain forms of cancer. Now with this diagram, I want to emphasize the impact of alcohol on a country such as Russia. Vodka, besides poor diet, it has caused many poor health outcomes for Russia. And Russia has the highest level of alcohol consumption in the world. This first diagram on the left, it just says, you don't even need words, it says. It's just, except that his ribbon around him says vodka, vodka, vodka. So many injuries are caused by vodka. The other diagram is the inside of someone's brain. And you can see he has a rich assortment of different types of liqueurs inside his head. Fascinating graph showing the male life expectancy at birth for men in Russia and how it dropped dramatically in 1990. And that was due not just to poor living conditions, but also a total change in the economy and the dissolvement of the Soviet Union. And with all these radical changes, these sociocultural, environmental changes, the male life expectancy dropped from 65 to 61 years, and it was lower than many less developed regions. And this shows, again, some of those reasons why men in Russia have such a lower life expectancy. This is a Russian male taking sick leave, and as you can see, he's got the cigarette on the plate, he's got the vodka, and, he's got a cigarette in his mouth and on the plate. But again, very stressful conditions, while at the same time, poor eating habits, scarcity of fruits and vegetables, and a high consumption of alcohol, which was exacerbated by the 1990 changes when the Soviet Union dissolved or fell apart. So one factor that Merson doesn't really go into is that stress, as you can see with what happened in Russia, is associated with many chronic health conditions. And how does stress contribute to the chronic health conditions such as heart disease? Well, if you are under stress, your blood pressure goes up, and as a result, you may overeat, you may exercise less, and you may be more likely to smoke to try to find ways to calm yourself. And these are not the most beneficial ways. So that can contribute to heart disease. At the same time, chronic stress exposes your body to unhealthy, persistent levels of stress hormones. So these elevated levels of adrenaline and cortisol have been linked to chronic diseases. And studies also link stress to changes in the way the blood clots, which increases the risk of heart attack and stroke. The policy responses that are needed are critical because chronic diseases aren't caused or aren't associated just with your individual behavior, your individual lifestyle. If you really want to change and to have an impact on chronic diseases, you need an intersectoral approach. You need to have governments. You need the World Health Organization. You need donor agencies. You need NGOs. You need private sectors. You need everyone involved. And these policy responses need to address some of these myths of chronic disease control. One of these myths is, let's wait until infectious diseases are controlled. And you cannot wait. It has to start now while these developing countries have this dual burden. Another myth, economic growth improves all health conditions, and that chronic diseases are due to affluence. Chronic disease only occurs in the elderly, and it's the result from freely adopted risk. And the benefits of control accrue only to individuals. So again, this is blaming the individual, whereas there needs to be an entire socio-environmental response to reducing chronic diseases. So you can't just have the health sector treating chronic diseases. You need many, many different partners. For example, you need urban developers who can look at cities and realign the infrastructure and make the city so you can walk on the sidewalks, so you can exercise. So you have parks, which can help not only to exercise, but also to reduce stress. And the strategies to prevent chronic illness, again, health promotion has to be for entire populations. And we have to focus on the determinants of health. And again, it has to be intersectoral cooperation. And this is another diagram from Merson, which shows an excellent framework that the WHO has developed. And it's an innovative care for chronic conditions framework. And notice at the top, you have to have a positive policy environment, which is critical. It's overarching. And the links then again, it's not just the policy, but you have to have community involved and the healthcare organizations involved and patients and families involved. So again, at all levels, you need cooperation in order to make an impact. So the best chronic illness care systems have a well-defined care plan, and they have patient self-management and preventive care. There's scheduled follow-up, proactive care. Monitoring outcome and adherence is critical. There are stepwise treatment protocols, and again, it's patient-centered care. And finally, chronic diseases require adherence, and this is a complex behavioral process. It requires voluntary involvement of the patient. And the YouTube video I assigned for this week is excellent as far as showing you a community health worker going to the homes and trying to promote adherence. And here you see some frontline health workers, again, partners in health, frontline workers saving lives. And again, with the Rwanda YouTube video, you'll see more of the community health worker actually going to the homes, but this is a typical clinic that you would find in Rwanda. And that's it for today. I hope you enjoyed the lecture.